here I am in the bathtub, like looking up through this window with like a crack of light and sobbing and being like, this isn't working anymore. Your body's trying to tell you something. Kind of was like reflecting there, sitting in the bath, trying to pull it together. And I had this feeling and this thought of like, the only way not to feel this anymore would just be not to be here.
This is Raising Mama, a hilariously honest podcast dedicated to unveiling the hidden realities of motherhood.
Our goal is to arm you with the information and tools you need to be your most confident and empowered self.
This podcast is packed with unfiltered testimonies, diverse perspectives, and expert opinions, along with a good dose of laughter and tears.
Leading you on this journey is my best friend, Megan Stander, who is a CEO, passionate maternal health advocate, and mom of 2 daughters.
Alongside me is my best friend, Chelsea Ledson, who is a mother, wife, and registered nurse with her master's specializing in women's health. Let's try to raise the next generation
By raising up mamas.
and maybe raising a little hell. Hey, y'all.
Hey, mamas.
Welcome back to Raising Mama. On today's episode, we have back Jenny Tucker, the leader and founder of Centerline Community, a virtual postpartum support community and meetup platform. Today, Jenny is going to be sharing her personal experience with postpartum depression. According to March of Dimes, up to 15% of women who have recently given birth may be affected by PPD. We hope that by sharing Jenny's story today that more moms may be informed on this highly closeted subject, and women who may be suffering from postpartum depression can feel some relief knowing that there are many other women out there going through the same thing too. This episode is not aimed to diagnose or take the place of a healthcare provider's professional recommendation. Kindly tune in as Jenny Tucker tells her real, unedited experience with postpartum depression. You'll definitely want to listen to the very end as we get into the deep subjects that no one wants to talk about. Welcome back, Jenny.
Thank you. I'm so excited to be here, especially because chatting with you guys feels like chatting with like my mom friends. So it's like so natural. I
That's
just
what
want
it
to
is.
come here and
That's
hang
what
out.
it is. Yeah,
I love
hanging
it.
out.
Well, awesome. Well, I feel like let's dive right into it. And Jenny, I'm just really grateful that you're here sharing your experience. I know it's not the world's easiest thing to be like, here's this deep personal thing that happened to me and put it out there. So thank you for that. And I just want to hear it. How was postpartum depression from your experience?
How was it?
How'd that go for you? It was a lot of things. And yeah, I'm happy to share about it because it's been very healing for me to talk openly and have so many moms reach out and say, thank you for talking about this. Like, I've been dealing with this too. And these are moms that are, not like super close to me that they tell me everything, but moms that you'd think that you'd know, like people in my community. And when they say, oh yeah, I was going through that too, hey, a year ago, it made me be like, oh my God, how many of us are going through this and no one knows, or it's like completely kept in the dark because we don't know how to talk about it because it's uncomfortable. So I'm kind of into being vocal about uncomfortable things.
Nice.
Yeah, so I'm happy to share. I had my daughter, who's my second, last November 2022. So I guess, yeah, she's 18 months old. And I had a really beautiful birth and postpartum experience with her. Really for the first 3 months, I had a lot of doula care. I had very intentional setup. I took, the first 40 days to really be horizontal. And in that also, I felt so much emotion bubble up. And I was very weepy in like a cathartic way though, which is something that I wanted, something I learned with my son, and then having a really messy and stressful postpartum experience with him in 2020 that I kind of didn't know. I didn't know it was my birth with him was traumatic and my postpartum was traumatic during the height of COVID until this second experience with my daughter. So that was all at the same time, very messy. All this stuff was coming up, feelings again, felt like this porous emotional sponge, just weepy but again, healing. I liked that part of all this emotion. But then after kind of 3 months, it continued to be very emotional and weepy, but that kind of wasn't working anymore because I couldn't just hole up in my bed like I did those first 40 days ish and experience this magical soupy messy postpartum. Like, I feel like soup is a word a lot of moms resonate with when you talk about postpartum, like how it's soupy.
Yeah.
Like you're kind of, like covered. It's literally soupy because you're like covered in milk and like it's messy, but it's so much with like I can even feel the oxytocin right now talking about, having your newborn on your chest and just like being in it, because I was very intentionally like, I'm just going to be in this. But then after 3 months, that was not working anymore.
So just to double back, did you experience postpartum depression with both your babies, or was it with the second one?
So it was in this next 3 months. So after those first 3 months with her, and then once those second 3 months of my second postpartum experience hit, that I realized that I had definitely gone through postpartum anxiety, depression, and a condition called D-MER that I know, Megan, you've shared about before too. Those three things, undiagnosed with my son, and at that time in the second 3 month chunk of my experience with my daughter, my second, I went and saw a provider, which I'll share about how that ended up happening.
Basically, you found out after you had your second that you had it with your first.
Yes, and likely perinatal depression during my pregnancy with my daughter. So there was basically this big moment of like, oh fuck, like I have been suffering for so long and I'm just now realizing it. And what happened was around 4 months, my daughter was 4 months old. My husband had some time off, which he basically never does. So we took a trip because we were like, oh my God, let's go somewhere. You have a couple days, which never happened. So we fly to Vegas with the two kids. They're 2 and 4 months ish at this time, drive to Zion, have like an amazing 4 days in Zion, just like basking under the trees. The kids are great. I'm probably like pushing it though at 4 months, like that's still pretty early, right? And I'm like in Zion, with a baby on my chest, pushing against, I'm still breastfeeding her. I'm dehydrated, most likely. She's on my chest all day. What happened on the last day, I started really not feeling well. I was like, Ben, you got to take the kids for the afternoon. We're going to fly out the next morning. And I was like, I am going down. I don't know what's wrong. I think I have the flu or something. What ended up happening was I got mastitis from dehydration and her pressing on my chest all those hours. It's like, duh. And that night I was like, I thought I was going to die that night. I don't know if anybody's had mastitis, or to the point that I did. Maybe it was worse than other people have had, because I was like ready to call an ambulance for myself. And I was like, I'm never making it home. We have a flight in the morning. It's not happening. Like, I'm going to die here, which was just, for anybody who's had mastitis knows, you just literally feel like you got hit by a truck. It's like the flu times 10. I would rather have another C-section and recover from that than get mastitis again. It was awful.
Quick, for anyone who doesn't know what mastitis is, do you want to just give them a quick blurb of what it is?
Yeah. So mastitis is, if you've ever had like a clog in your breast where it gets really red and tender, if that persists, it can get worse and you can get flu symptoms and a fever along with it. And it's this condition called mastitis, which basically inflamed I'm picturing the picture of the breast with like the tree looking. The tissue in your breasts. Yeah, the ducts. Yeah. Your ducts are inflamed and your breasts are super sensitive and in pain. And then also you get this terrible, terrible flu that could come with anything from fever, vomiting. It's just basically the sickest you've ever been in your life, along with inflamed breasts, and you're trying to feed a baby with them, and you're 4 months postpartum and dehydrated and you feel like you're going to die. So that
sounds like literal torture.
Yeah. I was like, it felt kind of like my body, saying, hey, slow down, which is exactly what it is. This is too much, so we have to get home. We get on the plane, we get home. It's early in the morning. My son goes to daycare. My husband's gearing up to go to work because he had to go back. And I was like, you can't go. Like, I am dying. I feel like I'm going to die. Like, I still might call that ambulance for myself, because like my body is not okay. And there I am with a 4-month-old baby who's nursing all the time. And I'm, trying to take care of myself still. I had a C-section. Stuff was still happening 4 months out. It's not all sunshine and rainbows after 6 or 12 weeks in postpartum. 4 months is still really fresh. So I begged him to stay home, which he's in an industry where that's not something that was easily able to happen. So he did that for the afternoon. And I remember getting in the bath. He took the baby and I went to go give myself a hot bath. And it was kind of like this physiological experience of getting so sick opened up some floodgates for me. And like, I just kind of had this moment in the bath, like sobbing, feeling so ill, this overwhelming emotional wave of like processing parts of my son's birth. I don't know why it manifested in this way. It's almost like I was really enjoying bonding with my baby those first 3 months. And then, like I kind of mentioned before, those first 3 months were so magical. But then once the world kind of expected me to like show up in a different way, and I couldn't just bask in the snuggles and like be early postpartum, because at 3 months, that's kind of not acceptable to people for you to like still be in bed all the time or like, and it also wasn't working for me. I think because I was alone, I wasn't with my doula or my husband or my family because early postpartum had passed. So I was like alone in those following weeks with my baby, kind of trying to hold on to this like magic that I felt. But I felt so connected with myself and my baby, but so misaligned with the world around me. I think because I was exiting that early time, and what I was experiencing, it wasn't aligning with what was reality in the world. And it wasn't working for me to be alone all day with this baby and like crying all day with this baby. It wasn't like magical anymore. It was like way more of the messy, like the soup was not enjoyable anymore. The soupiness, it was like, oh, this feels messy in a different way. Like I feel so misaligned with the world, and like a lot of pain and rage, I think, around the reality of new motherhood and how I could enjoy that part so much and feel a lot of healing. You know, with my son, I had a C-section, and there are pictures of us cheek to cheek, like, oh, here's your baby. And then they took him away for 30 minutes with no explanation. My husband followed, and I just laid there, and I did not know that that was traumatic until these moments with my second birth, which was way different. I was very intentional about skin to skin immediately. And again, this whole different postpartum intentional experience that I wanted, and I got it. But with that, it was like all this pain and rage bubbled up that I had been suppressing. So I was there, in the bath, feeling all the mastitis feels, and then this upheaval of emotion that I had kind of been maintaining. Like I knew I was very emotional early postpartum, and I kind of, again, like I mentioned, I don't know if people relate to this, feeling like it's almost like addictive. Like I wanted access to that emotion. Like the crying was cathartic, and it was like this healing that was happening, but also very painful and obviously like emotional in like a difficult way. But it's something about it, I like craved it, which when I mentioned that to my doctor, she was like, that's depression. That's not okay. You don't need to crave crying and feeling sad and like want to stay home to do that instead of going to be with people, which I was like, oh, like, you're right. Because I have never experienced severe anxiety or depression before. So here I am in the bathtub, like looking up through this window with like a crack of light and sobbing and being like, this isn't working anymore. Like this mastitis kind of dug me down to my core and like opened up, like I said, kind of these floodgates to be like, your body's trying to tell you something. Because I remember in that moment, both with the sickness and with facing myself in this experience with this emotional kind of soupy depression I had been maintaining and like that wasn't working anymore, kind of was like reflecting there, sitting in the bath, trying to pull it together. And I had this feeling and this thought of like, the only way not to feel this anymore would just be not to be here. I had lost hope in accessing parts of myself that could participate outside my house with other friends or family, or like maintain or like jump back into a life or a self that I had that I just didn't have access to at that time. And so I was like, I didn't make a plan to hurt myself, but I remember thinking like, I think the only option is not to be here. That's the only way not to feel like this. And in that moment, having another upheaval of emotion, thinking, did I really just think that? Like I have a master's in mental health counseling. I'm trained in depth on suicidal ideation. I've done crisis response, worked with teens. Like it's the total, this would never happen to me. I would never have suicidal thoughts. I would never get depressed. I would know, and I would get help. And here I am, a puddle of misery, and being like, wow, I think something's happening beyond my control. And I think this has to change. So that was kind of the rock bottom moment. And I mentioned something to my husband around, because that time was so difficult with mastitis and these feelings. He was like, you always told me with both kids that if I saw something that I was worried about, that I should tell you. So like hearing you talk about the way you're feeling right now, like I think I need to use that card and say, I think maybe you should go see someone. And I said, I think so too. But I still didn't, because I was like, oh, this is fine. I'll figure this out. Weeks go by, and one thing I had posted about that I didn't know I had until around this time too was D-MER, which we mentioned. And I posted about it on Centerline's Instagram, and a friend and provider, a very well-known breast surgeon and perinatal mental health provider and lactation consultant, wonderful provider, Dr. Mitchell, saw my post, and we had worked together in the past on some mom support groups and Centerline stuff. I posted about D-MER, like, hey, I'm just hearing of this. Does anyone know what this is or have experience? Because I think I might have this. And then she replied and was like, that's actually a very serious thing. If you think you have that, you should come see me. And I was like, no, it's cool. I read up on it and I'll be fine. And again, weeks go by. I finally make the appointment. I'm like, I don't even know if I'll go. And then finally get in there. She even texts me just making sure you're coming today. Yeah, I am. Thinking I'm just going to go learn about D-MER and different things, learn about breastfeeding stuff. When I get there and sit down in the chair, again, the floodgates opened and she didn't even have to ask. And I was just like, here's what's going on. And I knew that would happen in that appointment. I knew I had more going on that I could handle, but I proceeded to tell her about D-MER happening currently, depression happened. What I didn't know was depression. I kind of did, but yeah, I'm here's what's, describing the crying and the craving, just the closeness with my baby, but not in a joyful way, craving being close and sitting in a puddle and crying and wanting to spend my time doing that instead of going to mom meetups. And she was like, that's not okay. You don't have to spend your early motherhood months. You can connect with your baby and feel the joy, and you can feel rage around things that aren't working that are causing this, but you don't need to keep suffering. That part's not working. Can you see that that's not working? And I was like, that was really hard to face, to be yes, I can see that that's not working, because I knew that that would mean maybe something like medication, which I, for some reason, was really resistant towards. So there we are, in the appointment, I'm telling her everything. And then I had participated in a women's health panel at an event in Santa Barbara while I was pregnant with my daughter. And I cried during my portion because, well, now I know it's because I would probably had perinatal depression while I was pregnant. But, I was really fed up with, there's a VBAC ban in Santa Barbara. It's no longer there, but there I was pregnant. We could have a whole episode on that. But VBAC is vaginal birth after cesarean. Our hospital in Santa Barbara for about 24 years did not allow them because they said they didn't have the infrastructure in place at the hospital, which we won't dive into because I could literally talk for hours. But I was pregnant hoping for a vaginal birth because I had had a C-section prior. And so we had a panel that was touching on some of these issues and gaps in women's health in the area. Here we are in Santa Barbara, the wealthiest of the wealthy with so many resources, and women's health is terrible there. If you're pregnant, you can't see someone for 12 or 13 weeks because there aren't enough doctors. You're I'm in one of the richest cities ever. We have more nonprofits than any other city per capita, and I can't see a doctor for 13 weeks because why? So that was part of my pregnancy experience, was this rage and pain around, again, gaps in care for women and feeling it so personally. So I was crying through my portion, and Dr. Mitchell was I've been thinking about you since that panel, and tell me more about your pregnancy and your first pregnancy and your first postpartum. And so I sat in her office for a long time crying and just bearing everything. And she was like, this might be hard to hear, but I think you've been dealing with this for a long time. Yeah. So that was hard to face because it felt I felt disappointed in myself for pushing myself through and not getting help, which I think a lot of people, when it comes time to get help for something like this and face that you might have more than what is normal, which that word normal is tough because it's my opinion is that none of it's normal. The rates of postpartum depression are not what they should be. Which is part of getting help for me was it's very wrapped up in all these layers. But in that moment, it was okay, I owe it to myself to try something different because this is not working. And she kind of painted that picture of these last 3 years. It was I don't want all of motherhood to be like that, to be weepy and ragey and, which postpartum, a lot of it is, no matter what. But I was I can't go on like this. So she prescribed me generic Lexapro, which I was, yeah, okay, thanks. Took the paper and was I'm not taking this. Yeah, right. But which again,
there's
why?
a theme in this story.
Yes. Why were you so resistant to taking it?
I think it was a not me kind of thing. It was oh no, I have all the experience in, I went to school, to be a therapist. I'm not a therapist, but I have, the degree a therapist has, and I have a school's counseling certificate, and I train school staff on suicidal ideation to look out for depression and suicidality in teenagers. This wouldn't happen to me. I would know it wouldn't get this bad. Like that just wouldn't happen to me. And so
you're like in your own way. You're in your own way.
Oh yeah.
Yeah.
And here I am leading hundreds of moms and telling them, you don't need to feel shame around something like postpartum depression or choose any tough area of motherhood. Here I am, the champion for cheering on women and advocating for doing whatever they need to do to make their experience better and enjoy motherhood and not put shame on themselves. And here I am doing literally all those things, like getting in my own way of having a better experience, getting in my own way of receiving help.
Why do you think women do that? Because I mean, I'm like that too.
Yeah.
Like why? Yeah. What have you learned from the experience?
It felt like there's so much pressure to not need that outside support or like to have it all together, which is twisted, because here I am the person advocating for it's okay to need help. It's okay to ask for help. This isn't your fault that you feel this way, whether it's struggling in motherhood, or that was kind of how Centerline started out, was like kind of when I was like, why was no one vocal about how hard this is? And like, if we all don't talk about this, it's going to continue being really hard for everyone. So like, why are we all in our own way here? And we're kind of in each other's way by not sharing, right? Like I like sharing this story so that the next mom doesn't wait 2 babies and 6 months to start her medication. Like, I don't know why the resistance is so hard. Like it's so, right? Because after, she gives me the prescription and I'm like, yeah, sure. Thanks. Weeks go by and she and my husband are like, it's there. Did you go? I'm getting the notifications. Your prescription's waiting. And I'm like, I think it was maybe 2 full weeks. So she called it in and I knew where it was. And she was like, are you going to go get it? I was like, mm-hmm. And then my husband's like, are you going to go get it? He's like, yep. And just like, like tried not to. I don't know why. Like, it was like, I had to, if I went to pick up that prescription, then I was saying, I can't do this on my own. And I need these pills to help me be a better mom, which they do make me a better mom. And I'm so glad I started the meds. I don't know why it's so hard to take that step, because Dr. Mitchell said the same thing. If you had a heart condition, you would not hesitate taking medication for it. This is a medical condition. There's a chemical in your brain that's not responding the way it should be because of happenings in postpartum and childbirth. And that's not your fault. And you don't need to resist. And for some reason, it was still like, I couldn't accept that someone like me would need medication. So she was on the tarmac at LAX about to fly to Croatia for a medical conference and texted me and then called me and was like, did you pick up your pills? And I was like, no, not yet. And she's like, Jenny, I'm going to Europe. I need you to go do that. I was like, okay. She was like, I'm literally about to fly. Like before I take off, I need to know that you're going to go at least pick them up. And I was like, okay, I can do that. I'm getting in the car right now. They went and picked them up. And thank God she was so persistent. Thank God my husband was there for me too, to support me, because 3 days into taking, so I bring it home and Ben's like, my husband, you brought him home. You're taking these. Like, we're doing this. We're trying it. You're trying it for 2 weeks. Like, just try it. Cause it had continued on the same way. I was kind of like, no, maybe I don't need it though. Maybe that's too far. And it was like clearly all the same. Just weepy and sad and ragey and like not wanting to participate in this own community that I had worked so hard to cultivate, and that I encourage moms, hey, this is here for you to get out of the house and be around other moms. Even if you don't want to chat, even if it's a hard day, get out of your house where you're alone, tracking every feed and nap. And right, we all know that like early, like incapability to leave the house. It's like, normal and maybe okay and acceptable for the first chunk where you're like figuring out how to have life with the baby. But I was like, this baby was getting to be 5-6 months old and I have a toddler. It's like, I kind of need to like participate in the world and in the family. And I just couldn't. And he was like, let's try this. And I was like, oh, okay. And started the meds. And 3 days in, I was like, is this what it's like to feel normal? Like, is this what it's like to live? I cannot believe I waited so long. Because one thing I was nervous about when I talked to Dr. Mitchell was, I don't want to numb the pain that I feel and accept taking this medication. It feels like just slapping a Band-Aid on a way bigger issue. And she was like, Jenny, you don't need to take on this issue for every mom. Like, you need to take care of yourself right now. Like, you're not going to be able to keep leading moms and keep leading Centerline community if you can't function. It's like,
Yeah.
okay. So yeah, I kind of started the meds and felt better. And then with that, I was like, I need to take off some hats and like not just take these meds and keep pushing through, but take these meds and start therapy and just kind of scale it way back. Like, because I was, leading groups, running my business, taking care of my 2 kids while my husband works constantly. And just like, I was wearing hat after it. That's what my first therapist told me. I was sitting on my bed where at my house in Santa Barbara, all my hats are on the wall, my like fashion hats. She was like, look behind you for a second. I was like, what? She's like, do you see all those hats there? Like, this is your new metaphor. Every time you walk in your room, like, you are wearing all of them all day and night. Like, you need to take them off. So I was like, my new journey was like slowly taking off some hats. And what I realized is like, I was wearing a fuckload of hats and taking on all this energy and endeavor, like, for every mom I ever saw and met or thought of, like, and it was weighing me down. And that's what pushed me into this depression. Like, that, along with right systems and setups for early motherhood and ways that were being failed. Yes. Also, this condition with D-MER, with a literal serotonin drop in my brain that's not functioning correctly, that's causing this weepiness every feed. There was a lot happening. So I got off Instagram. I emailed my community and said, hey, I'm taking a break. I didn't go into details, but just said, something has to change. I'm going through a lot right now. I'm stepping back. Had some people kind of help me continue to run the community at that time. Started medication, felt amazing. But again, it wasn't what the way Dr. Mitchell explained it, which I started to say was that I was like, I don't want to feel numb or like just smack a Band-Aid on this and push on. She's like, no, this is going to bring you back to a baseline of where your brain needs to be to function. And then you can still feel everything, but the baseline is here and you're like way down here, and you're alone taking care of 2 kids, and you're running a business, and you're dehydrated and right? Just like everything piled on. She's like, that's not working for you. Like, this is not a crazy thing to like, you're literally just she gave me, 5 milligrams. This is barely anything. It's going to bring you to baseline. And yeah, 2 weeks into being on meds, I was like, this is a whole new world. I was like, yeah, I got to figure out a way to talk about this and make sure people who aren't resisting it like me, because it changed everything. And the last part I'll share is that we had a family vacation to Hawaii where I kind of was able to, like, I started the meds. A couple weeks later, we left, disconnected, got off Instagram. Was kind of like, okay, this is summer Jenny, is no Instagram, and, just taking it day by day and being kind to myself. And that's what I did. So I took about 3 months to be off Instagram and make sure the meds were working for me and reassess. And then my husband got a new job and we moved. So that was like, whoa, like a whole other thing. So it's been going amazing since then. And just on Thursday, a few days ago, I hiked rim to rim in the Grand Canyon to sort of commemorate a year ago taking those meds and feeling myself again and enjoying motherhood again. Yeah, because I really wanted to celebrate all the
accomplishment.
Yeah, and just like it's been a
we
lot.
went through it. Yeah.
Yeah. And so I was in that canyon on Thursday, being like, this, it was so hard. It was 24 miles. It took me about 14 hours. I need to Google again the elevation gain, but my blistered feet will tell you that it was so challenging, but it was still nowhere near how challenging it was to be holed up in my house, depressed for all those weeks and kind of not even know it.
What do you think made you want to take on that collective pain for everyone, or what do you think in your psyche made you feel like you had to like go through this? Because it's interesting how people sort of act against their own rationality. And I'm just curious if, because you mentioned you went to therapy, if you put the pieces together on that, because, for example, you got through this hurdle of PPD. I mean, as much as you can, you got the meds and you've experienced a certain level of recovery, but this probably won't be your last challenge in life. So what advice can you give from a growth standpoint in terms of like, I guess taking when to decide to take care of yourself or what to look out for in your personality that might or how I even logicize it to yourself the next time this happens, because you were highly persistent in that pattern
Mhm.
of like stringing along your own mental health. It's like you were taking the steps, but like, so do you feel like taking the meds was the like ding, 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 okay, I can get out of this pattern? Or do you feel like there's something else there still and that this could happen again, just in a different scenario?
Yes. Okay. You're right. I was highly persistent in, right, like avoiding this inevitable reality that I needed help. Seeing a wonderful motherhood coach who's so aligned with, motherhood and matrescence at the center of this experience and the therapeutic experience. And her name's Kelly Van Zant. I read her book, Powerful Postpartum, in postpartum with Leona, my daughter, the second time. And it was like, it spoke to me so deeply. And so she's really been a great guide and helping me like hit at exactly that, because I'll share and she'll be like, I feel that collectiveness, right? This like you're taking on this collective pain, but like you don't need to do that all the time. And so we've been really parsing out, like, again, kind of with those hats, like how to put one on for a little bit and like fight the good fight, because it needs to be fought. I think I'm the type of person where I feel so deeply and I feel for others so deeply. My husband jokes that he doesn't like to watch movies with me because I am like so invested in what's happening. And like after a movie, I'll need like a decompression session and like sit there
Yeah,
and like,
you're an empath. You're like
yeah,
a deep empath.
same.
And
Yeah. Which is, I think it's
it's
such
a
a
good
gift.
thing. Yeah.
It's a gift. It's brought me to where I am with Centerline helping moms. Like I saw and felt this gap so deeply when I had my first baby and was like, this isn't okay. I'm so lonely and freaked out.
But how do you take that energy and apply it to yourself?
Yeah. Yeah.
You
I
know?
mean, that's, I guess, what I learned the hard way. And I don't know, Megan, because I think of later challenges, like you mentioned, like how, like this will come up again, like whatever thing will rear its ugly head. And I'll be probably, right, like we all are, like creatures of habit in this way, especially in our own personality of like, oh, there's that thing again. And here's my reaction again. Like this is right how I'm wired. It's like, okay, how do I unwire that? Which is what I'm figuring out, so I can recognize this in myself and share about it in a way that helps people recognize it in themselves and help us all stop getting out of our own way. So I'm kind of still learning that, like how
Yeah.
to,
I'm like, I'm
create.
asking for advice. I'm not asking for a friend. Like it's for me. I
Yeah,
have the same pattern.
I feel like, really, because when you was asked something in your question there, you're like, how do you decide when to take care of yourself? It's like, I think we all need to unlearn that there's any moment where we shouldn't be taking care of ourselves. That's like
Mhm.
the biggie is like, we're kind of taught to set that aside and do what I did to like only go there if it's like absolutely necessary and just like push on regardless, or, like push on unless, right, you get mastitis and want to kill yourself, like, oh, then you should go get meds. It's like maybe before that bathtub moment of like deep darkness.
Yeah, like we don't need to hit rock bottom
Yeah.
to get
Yeah.
help. We need to
Right.
assess when we're on that downhill
Yeah.
and take action before we hit the rock bottom so that we can
Yes.
course correct.
Yeah. Yeah. And I don't mean to, mentioning that saying, mastitis and thoughts of suicide, like poke light at that at all. But it's like, it's almost like, right, I'm putting on another hat to be like, I need to be an advocate for mental health to, more. I need to talk about this more, which like I want to, because again, so many people came out of the woodwork being like, oh my God, I had really bad postpartum depression too. Like hang in there. And it was like, wait, what? You did? How did I not know? And like, why are we all going through this? It was kind of like that same moment in early motherhood where I had a baby and was like, this isn't working. Just going about my day by myself with my baby. Like we need places to go to be together. So I created Centerline and created this business and community to fix that gap, because I guess I'm kind of like, maybe another personality thing is like, I don't want to settle. Like if I see a problem, it's like, I was like this in the workplace. And I feel like at every job I've been so annoying to everybody because I'm like, this isn't good enough. Like we should do better. People are like, ugh, Jenny's at the meeting again. Like, and it's like, I worked with students and was like so powerfully advocating for them. But I had a baby and got burnt out doing that because I couldn't
Mhm.
take care of myself and my baby and fuel that fire, saying public schools and, society needs to be better for these kids. It was like, again, even saying this out loud, I'm like, it feels like a therapy session where I'm like, oh yeah, okay, there's a lot to deal with. I'm seeing these patterns, like getting burnt out on these, fighting the good fight. It's like, can't do it all the time.
One thing I'm definitely hearing is that there's like a mindset, right, of I versus we. So there was like this really cool study that was done where they asked a bunch of people from different places like Japan, China, America, describe yourself. And some people would say that, like, usually if you're from like a Chinese culture or a more like we culture, it'd say like, I am a daughter, or like, I am, and it'd be part of the we. Whereas like in America, it's like, I am a businesswoman. I am thin. I am tall. Like, it was much more I focused. And I think that it's interesting because like with medicine, it's very I, right? It's your problem. You're the one who can't stop crying. And so you take the pill and you're the problem. Here's the solution. And it kind of cuts out the we, right? Which is like very real, that society is not set up to support collectively, right? Which it's like in this motherhood, you need, like you said, centerline, mothers need places to go with their babies to be fueled. And it's like this dichotomy of, you don't want to take the medicine and just be like, oh, it was just a me problem. There's nothing wrong in the world to fix, because that's not true. There's tons in the world that needs to be fixed. And so it can kind of feel like you're picking two sides of the equation, right? And your probably natural instinct was to advocate. You wanted to be like, no, I don't want to take the pill because society's got a problem. I want to fix society. Right. But then your therapist was like, or this is society that you live in currently. You're just killing yourself. I agree. It'd be wonderful if we could like fix this, but it's not going to happen overnight. So till then, let's work with what we got, and again, it's like, yes, you are personally suffering, but in a systemic system where I was just reading, one of these Kaiser studies, and it said like around 2010, it was about 9% of women were getting diagnosed with postpartum depression. Whew, say that 10 times fast. And then about 10 years later, it doubled, like 19.7%. So it's like in 10 years, postpartum depression is doubling.
Or it's just being diagnosed more.
Or society's changed so that motherhood is such an isolated experience. Like this whole 1950s nuclear family, like one person taking care of a kid is so much. And then you put on top of it, maybe you're an empath, maybe you're an advocate, maybe you're one of these people who just wants to solve problems. You don't want to just take medication and feel like it's a Band-Aid. It kind of all starts collapsing against us. And it's like you said, Megan, it's the worst to wait till the very bottom, till you're really at the very bottom, because once you're there, even just getting to a doctor's appointment, even just getting to that mom's group is like, you kind of need someone to do it for you. And like you said, thank God you had your husband. Thank God you had the world's most persistent doctor in the world.
Thank God.
I love you, Dr. Mitchell.
So it's really, it's like,
it's a positive feedback loop. It's like,
it's two things happening at the same time. We live in this I culture. We have society that has things going against us. And we live in this ultra healthcare medicated world where like, that's the lens that health is in, medicine. And there's way more to being healthy than medicine.
Yeah. Okay. This duality that exists in every aspect of motherhood. That's the biggest grace for myself, was through realizing this duality of, I can fight for systemic change. I can dedicate my business and my life to advocating for mothers and do that every step of the way. I can do that, and I can take medication for my postpartum depression and not resist getting help myself. When I realized it was like, I was really getting in my own way by feeling like it felt like if I took the medication that I was taking these systems off the hook for, like, saying they weren't responsible for failing mothers because, oh, we don't need you to step up and actually care for us, society and culture and healthcare. We'll just take this pill instead and we're good. It felt like taking that step and actually taking the medication was saying that. When I realized that that wasn't the case, that those things can be true, both can be true, a lot opened up for me. And I think that's really the same in most really tough conversations in motherhood and parenting, you have to recognize that duality piece, or we're not going to get anywhere, because then we're either not going to talk about it and we're all just going to suffer through depression and not know it, or take medication in silence and not share about it, and then these problems perpetuate. If we don't engage in this, in both sides of those conversations, and really dive into that duality, then I think things won't change. So once I realized that, it was like, actually, this would be better if you went to therapy and took medication and talked about it. And then we can inch toward a world where only people with the chemical imbalance in their brain are taking a pill for it. And the culture around us, supports that percentage for postpartum depression going down instead of going up. But again, like you said, Chelsea, that's not happening overnight. So me resisting medication is actually hurting the cause. Once I realized that, if I thought about it collectively and was like, I can't be a stand for moms if I wither away or if I can't leave my house. So this is not helping anyone. So realizing that duality was a game changer for me.
Yeah. And just to add here, because, we've talked about medication a lot in this podcast episode, kind of as the antagonist, like Jenny v. pills. And I've been on meds my whole, not my whole life, but since I was 13, on and off, have done many months without it in a row. I've tried everything: Prozac, Lexapro, Lamictal, every SSRI that exists, gabapentin, just you name it. I've tried it. And not only that, I keep thinking about, what if you went on the Lexapro and it didn't work properly, and then you had to, because I took Lexapro, I couldn't stay awake. And I think this happens a lot. I had a job where, and I even took it at night before bed, instead of in the morning. I had a job where I literally had to, every 20 minutes, go in the bathroom and close my eyes. I couldn't stay awake. I just needed to sleep all day. And as soon as I went off it, I was totally fine again. And that can happen when you take meds, and it's even more difficult if you're already against it. You finally take it and then it doesn't work, and it just reaffirms your belief that this isn't right for you. But the thing is, and I think this is my piece of advice for people that feel like they might have PPD, feel like the next best choice based on this interview, or based on, doctor recommendations or just friends talking to them, they need to go on meds, is if the first one doesn't work, try another one. Try another one. And sometimes you need more than one. And it doesn't even need to be that you take a lot. I've always been on extremely low doses, but it's not this magic situation. You just snap your fingers, you take it, and you feel better. I think it's amazing that worked for you, but it's okay to try a couple, don't give up, even if one doesn't work. And I firmly believe in, therapy and working on your traumas and your childhood. And I would love to be in a place, I even take homeopathic remedies. I would love to be in a place where one day I don't need to take meds. But unfortunately, I've been on this planet for 34 years and fucking shit keeps happening to me. That makes me sound like a victim. I'm not, but I keep fucking shit up. And it could take me another 34 years to get there. And the meds help me be able to at least wake up and feed myself and take care of my kids. And they are a blessing, but there is a duality. It's yes, I want to be able to take as little of them as I can. I want to be doing all of that other work too. But in the end, it's just a little tiny white thing. I drink with water every day. Who cares? If it makes me feel like I'm actually in a state of mind where I can have some clarity around what to do next. That was the one thing that I learned, is that when I am not on meds, my decision-making ability is I think that I know what my reality is, but like then when I take them, I'm like, okay, your reality was fuzzy. But you have to kind of flip flop between. That's why I've been gone on and off, and that's like a whole nother story. But anyways, I just kind of wanted to say that like in my life, meds were not the antagonist. I needed them. They've always helped me. It's so normal for me. I talk about them all the time, and like they are not the enemy. I can be like wildly feminist, hating the patriarchy, hating the system, hating all of it, and still be like, yo, I need my Prozac.
Yeah. Yeah. That's really interesting what you mentioned about, I have never thought about how grateful I am that that first dose and that first brand and that worked. Like that is such a good point that for so many people, it's been a journey, let me tell you, but that the journey is even more complicated. Yeah.
Can you take these medications when you're pregnant?
Okay, so this, I had to go through a lot with this too, but there are certain ones you can't. Like I couldn't take Lamictal when I was pregnant or when I was breastfeeding. So that was kind of shitty in the beginning. So I'm like, all right, guys, like I'm trying to fly the plane, but like I don't have all the right things. But I think Prozac, they say is safe, and all of us like, dude, they just fucking find out that like Tylenol isn't safe to take while pregnant, causes autism, and it's like, how many fucking people have been taking Tylenol? So I don't want to say that anything is safe, but Prozac has been around the longest. Tylenol's been around for a long time too, so I don't know, but that seems to be the safest one, and Prozac has a longer half-life than other meds, so it is a good one to like. It's easier to switch on to and switch off of, but there's a lot that you can't take.
Yeah.
But you kind of might need something, so there is something you could try. But Prozac really doesn't work for a lot of people. It makes them more depressed. It can be a slippery slope,
Which is why it's so important to not just use it as a Band-Aid, because there's a good chance if you're having kids, you're in that season, you might not be able to even take the meds, and you'll still need to focus on nutrition and exercise and sleep and your support group and when you're in your best stage to really hyper focus on it, get your therapist beforehand.
Yeah, but the thing is that it can also be equally dangerous not taking them, because if you can't feed yourself, and like I'm sure your baby is feeling what's going on with you, like neurochemically and stuff too. Like if you can't, that's also harmful. So you have to kind of decide between,
Yeah, no wrong way, no right way.
My new motto is like, there's no right or wrong, there's only options and pros and cons. You just have to weigh them.
Yeah. And it's like, right, this collective crisis that's happening with these rising rates and just maternal health care in general, mental health included. But then it's also so personal, these decisions, right? To take medication. What am I comfortable with? What, just like what you're saying with different medication stuff coming out, safe or not safe. It's like, yeah, you just got to do the best you can and go with your gut for what, might work for you. And for what I learned was just to like be open to something you didn't think would happen to you. It's like no one is safe. Postpartum depression does not, what's the word?
Discriminate.
There it is.
Yeah. There's so many layers we could dive into for all these, right? Different. And I just I love just the idea of having more casual conversations like this and sharing the reality of what we're experiencing and normalizing that. It's like, I don't want to normalize postpartum depression because it should not be normal how rampant it is. Like, I still truly believe that, like I said before, I can take a pill to help my experience and feel amazing about that and not be ashamed of it, but also recognize that I truly believe that, hopefully one day if we shift things to recenter mothers in our world, which right now they're really cast aside and neglected, that those rates would go down and we would need less pills, but that's not happening tomorrow and that's okay.
I love it. Well, Jenny, thank you so much for being so, just honest and straightforward and sharing your story. And there was a lot I learned. I honestly learned a ton today. And of course, you guys, always feel free to reach out to Centerline community. And if you're having any struggles or feeling like you have postpartum, this is your big, hey, it's okay. Lots of people are doing it, and we support any choice you want to do. So just keep putting one step in front of the other. We're all going through it together. So it was so lovely seeing y'all today.
Thanks for having you. Keep fighting the good fight.
Thank you. You guys too.
All right.
Thank
Bye, Mama.
you.
Thank you for tuning in to the Raising Mama podcast. Your presence means a lot, and we hope you found our discussion insightful.
To become a part of our community, follow us on Instagram at Raising Mama Podcast. Explore resources on the Raising Mama Village located at www.raisingmama.com.
You're never alone on this motherhood journey. We're here to support you every step of the way.